The PRO device features 4 alarms. It's easy to determine the alarm condition that must be addressed. When the audible alarm sounds, the number of beeps heard is the same as the number flashing on the screen. The guide beside the display screen tells you what the number means. When a 1 flashes with 1 beep, a low pressure or leak condition exists. You may notice that even before the alarm sounds, the pressure light is flashing rapidly and the device is making more noise. The device is trying to re-establish target pressure. If it is unable to do so within 3 minutes, the audible and visual alarm will activate. Remember that several tiny leaks can combine to cause the low pressure or leak alarm to be triggered. Once the leak or leaks are resolved, the PRO will immediately reset. The alarm will stop, the device will become quiet, and the pressure light will be solidly lit. If you are unable to find or stop the leak, contact the Cardinal Health Clinical Support Line. When a 2 flashes and 2 beeps are heard, it's time to change the canister. Changing the canister is easy. First, turn off the PRO device and disconnect the suction speed connect tubing from the canister. Press the silver button located on the device just above the canister. The canister will drop out and can be removed from the bottom of the device. Slide the new canister through the canister holder. Line up the short ports with the device ports and push up to click into place. The canister full alarm will sound when the canister is approximately 90% full. Keep the PRO upright. A canister full alarm might be triggered if fluid enters the canister when the PRO device is lying on the face or upside down. If this happens, the canister must be changed. If there are 3 beeps and 3 flashes in the display, the battery is low and has less than 20% of charge remaining. The PRO device must be plugged into a power source to recharge. If the device is not plugged in within 30 minutes, the battery will be completely discharged and the device will shut off. It is recommended that the PRO device be plugged in whenever possible. Alarms 1 through 3 may be muted for 5 minutes by pressing the green on button while the alarm is sounding. The alarm condition number will continue to flash in the display screen even when the audible alarm is muted. When a number 4 flashes and a short beep or chirp is heard, it is time for the device to be returned to Cardinal Health for service. This alarm cannot be muted by pressing the on button. Immediately contact your healthcare provider for a replacement device. Remember to consult the PRO user manuals and quick reference guides for more information. You can get clinical support by calling the Cardinal Health Clinical Support Line or contacting your Cardinal Health sales representative for more information.